Hello everyone, welcome to my channel. Myself Dr. Mega from Homeopathic Clinic. Today in this video I'm going to talk about Lachesis. What is Lachesis? Lachesis is an animal kingdom and it comes from a snake family. So if you're really kind of wanting to know about this remedy, you should be really watching this video because this Lachesis drug picture has been really kind of wonderful because it has almost all kinds of traits and it has all kinds of so much of disease related amelioration also, because it is one of the deep acting remedy and the behavior of the Lachesis people will be just like the snake. Okay, moving on to the, without any delay, let's move on to the explanation. So if you want me to explain in any other way, or if you are finding any kind of difficulty after watching my video to understand the medicine or to look into that, you can just comment on the comment section. So I'll be looking into that because I'm seriously a newcomer, so I'm explaining according to my thoughts and my opinion. So if you really have any kind of suggestion for me, you can just comment on the comment section. Moving on to the Lachesis. What is Lachesis? Surkuku snake. Okay, we derive the medicine from that snake's poison and we triturate it, we potentize it. After that the medicine is prepared. After that we will be giving it to the patients. Of course it's not going to have any kind of side effects, it's not going to do anything for you, but it can really treat you. Because on my first video only I had explained you that how homeopathy works. Homeopathy is a system which is like yours, like similia similibus curanter, means what can cause the disease can really cure the disease. This is one of the motto, this is the motto of homeopathy. Okay, the Surkoku snake. Lachesis was proven by the Dr. Herring, who was also a very great practitioner of homeopathy. Lachesis is a very long-acting, deep-acting proliferous remedy, because deep-acting remedies should be given in very minimal dose. I'll be saying that in a later explanation why it is deep-acting, long-acting, and everything. How the Lachesis people will be there to look at. Suited to hold toppers, subject of broken down constitution, and in trouble incident to the climatic age. Circulation of Lachesis subject is very uncertain, causing the sudden attacks of giving away of strength, fainting, vertigo, rush of blood to the head, causing so much of seizure kind of, means epileptic kind of symptoms, sudden flushes during climatic period. Lachesis is suited to the thin emaciated person who have changed physically and mentally through their illness. Complexion is sicky, women of with red hair and little bit of wrinkles on their face. And you can also give it for the persons, means the patient, how the Lachesis will look like. They are really attractive. Their skin is just glowing like the snake skin, and their eyes are very sharp, and they have so much of fear, because you know that the fearness is there in the snake. They have this kind of, means sickly look, and during a change of weather they have the symptoms here and there, and they also have fear so much. I'll be explaining the fear when it comes to the mind situation, so don't worry about it. Let's move on to it later. Moving on to the relationship with heat and cold, means like I said, patients are hot patients, means they feel the heat very easily. They're not chilly patients. They are very like I want cold water, I does not want to cover up myself, I want fanning all the ways, like that. And if you look for the keynote symptoms of lachesis, first thing is aggravation of complaints from the sleep, because the patient always complains that when he cannot really wake up from his sleep happily, he'll be always unhappy, distressed, and anxious, wakes up in panic. That is one of the best rubric if you are thinking of wakes up in panic, or if the patient says that if I sleep my problem starts, then you can think of lachesis. Oversensitive to touch, because even the snakes are very oversensitive to touch, so you cannot touch the snake. Even if you're one moment, they also feel like okay, something is going to happen. So that kind of thing is there. Intolerance to touch and slightest pressure. They cannot even take up the pressure. Person cannot tolerate collars around the neck or even wet clothes to be touched. Means the person who is means just imagine one young person who wants to go to the interview, but he cannot put up his collar button, because that is very kind of uneasy for him. Even he cannot tie up his tie, so he always says that okay, it's only 5 minutes, I'll be better after 5 minutes, or he does not do that only if there is an opportunity. That is one of the specific symptom of lachesis. Aversion to tight clothes around the neck and wrist. Everywhere wants loose clothing. Everywhere. They always tend to wear loose clothing. By their appearance, when they come to the clinic only, you will come to know. They are very shiny, faces shiny, lean, thin, pale look, sickly look, and there is around dark circles, and they are wearing so loose clothes, even if they are thin. And you can just find out by the way they act. And left-sided remedy symptoms go from the left to right, right to left, that is lycopodium. But here the left-sided remedy symptoms go from left to right. Aggravation of symptoms from the heat, warm drinks and spring. Amelioration from onset of discharge. Feels better when menstrual flow begins. This is one of the peculiar symptoms of the lachesis. Means amelioration from onset of discharge, means they feel better from their period. If the period starts, they feel better. Sense of constriction everywhere. Throat, heart, and the stomach. Patient cannot bear slightest touch of even the blood clots. Feel suffocated always. Lachesis is full of inflammation of glands and cellular tissues with purple appearance. This is one of the peculiarity of the lachesis. Moving to the climatic thing, have never been well since that time, says the lachesis patient suffering from the menopausal period. Means during the menopause, the flow stops, because the flow is the one thing which was making the female better, but now here due to menopause the flow has been stopped. So they say that after that I am not at all well. Elements caused due to suppression of menstrual flow with hot flashes, headache, etc. Burning vertex is also there, headache, especially at or after menopause. And you can also give it with the cardiac affections along with other elements causing the cold extremities and heat on the head, and skin covered with sweat, sense of constriction and suffocation everywhere. Desire for open air. Great desire for fanning, but slowly from a distance. This is one of the peculiarity. They always want fanning, but they also want that fanning from the far and the slow. Throat complaints begin from the left side and going to the right side. Aggravation from the warm drinks, lightest touch, liquids more painful than the solids. This is one of the peculiarity. means liquids are more painful than the solids, means the juice is very painful than the rice eating, like that. Rush of blood to head after alcohol, mental emotions, suppressed or irregular menses, left-sided thing, and weight and pressure on the head. This is one of the specific thing. Great physical and mental exhaustion causing trembling in the whole body, aggravates in morning after waking. Could constantly sink in the weakness. Hemorrhagic diathesis. Small wounds bleed easily and profusely. Blood is very dark and non-coagulable. Boils, ulcers you can think of, and with the pain. And any kind of Peretz problem you can think of, Lachesis. Of course, you can think of sepia also. Okay, moving on to the mind symptoms. This is one of my favorite part in the Lachesis, because when you are looking at the Lachesis, of course, you should always think of the mind part, because if the mind matches with the Lachesis physical symptoms, if they match a little bit also, you can just give it, because the matching of mind symptoms is very kind of necessary. Cloudy state, sadness, melancholic, insane notions, jealousy and suspicious. Chronic complaints from long-lasting grief and sorrow. Great loquacity. What is loquacity? Great talkativeness is called as great loquacity. Patient constantly keeps talking and changing ideas. Means 2 days back he has given some idea, but today he comes and he says, just let modify this, that, this and everything. Like as his patients are very talented. They can do anything like that. Easy flow of ideas will be there for them. Jumps from one subject to another. When talking, when talking they also say that this you can do, this you can do, that this and everything. Moving on to the when taking an warmth bath or after getting warm, mental symptoms are really feeling aggravated, means they are really kind of irritating for them, making them uncomfortable. Emotions are quite strong, quite attracted to people and objects. Attachment is so strong that the patient gets jealousy always. This jealousy can progress to suspicious and further progress to some other things. So if your wife is an Lachesis, then the suspiciousness is meant to be. Okay, so how they will be suspecting, I'll be also kind of sharing that. What is suspiciousness according to the Lachesis? The patient imagines that the people are cooking things against him. His family is doing something for him to make him really go down of his business. Appreciation of the future cannot be done. Things or dreams of snake that they always get in their dream can go into the deep state of anxiety, worrying about health, especially the heart symptoms. Thinks that she is nobody else under superhuman control. She is compelled to do things by spirits. Sometimes she takes form of voice in which she is really wanted to do the things. She has no peace of mind until she makes an confession of something she had never done. The state of thing she will be going is called as delirium, and she also go with delirium with muttering. Patient seems to be really attracted towards the alcohol, and they also stumbles while talking, while speaking, or hardly finishing the words. Face is purple, head is really warm. And they will be always having this confusion of mind. Because of that, they will be always changing from one thing to another, changing of ideas. The patient keeps always talking. And another thing is that they are highly religious. Why? Because we always worship snake as our god, so they are highly religious persons. Is a sweet old lady full of means weakness, and she feels that she has really done something wrong. Because of that, she wants to ask forgiveness from the god. She feels that she has done something wrong, and she is going to really be punished by the god. Because of that, she should do something so that the god can really forgive her. There is another kind of loquacity, means talkativeness, belonging to the Lachesis patient, that they are always in a hurry for everything she does and wants everyone else to hurry. With that state of hurry is brought on the state of loquacity. The patient rapidly changes from one subject to another sentence, or sometimes only half finished. She takes it for granted that you understand the balance, and she will hurry on. Mental symptoms are closely connected to heart symptoms. Prolonged melancholic mental depression with pain, all gone sensation is there, and weakness in the heart with difficulty breathing. Person may quit a job because he or she is being uncomfortable. If asked to do something immediately by his wife, he will be feeling so much of pressure. Excess or over stimulation is there in the Lachesis. Lachesis is on the really high level deep acting, and both in the physical and the mental symptoms. Moving on to the headache symptoms of Lachesis. Causes: stopping of a natural discharge like menses, coryza, perspiration, nose bleeding, anything will be the cause. Means even they will be having a little bit of running nose or high discharge or period, something like that, but when the stoppage is there, they always kind of go into this headache in the after taking alcohol. Also, you can think of Lachesis. Headache in alcohol people with high blood pressure. Headache in fever with frequent and violent sneezing. Where the headache will be there, what is the location? Pain comes in the waves from back of the neck, head, and then over the head. Left-sided headache going on the right side. How the sensation is: weight and pressure on the head, pressing and bursting headache, because the pressure or the touch cannot be taken by the Lachesis people. Oversensitive to touch, but heart pressure often gives relief. Sensation as if head is hammered, means it's been beating like that. Rush of blood to the head. What are the better thing which you can do during the headache of Lachesis? Any natural discharge like running nose or sweating, anything should happen. And what can really make them uncomfortable? Warmth, motion after sleep, on waking in the morning, noise, or even the conversation can really kind of do it. What are the accompanying symptoms with the headache? Coldness of extremities with purple eyes, or even the pale face. Vertigo with nausea and vomiting, pulsation all over the body. What are the eye symptoms? Inflammation in the eyes, worst after sleep. Eyes are oversensitive to touch and light. Eye symptoms with headache because of general disturbed circulation. Violent pains in the eyes from touching throat, in a sore throat when a tongue is really kind of very sensitive. There is violent pain in the eyes also, and lacrimation is there. Sometimes it's burning, sometimes it's not burning. What are the ear symptoms? Oversensitiveness of internal auditory. Anything introduced to the ear is very painful, and it also causes coughing because of the tickling in the throat. What is the face symptoms? Purple face or puffy eyelids, and there is pale look of the face. Face looks swollen and inflamed due to the various things, and at sometimes the face becomes pale and cold also, and the skin is covered with the scaly eruption, and they can really bleed easily also. And moving on to the respiratory symptoms. Person takes cold easily with frequent suffering of nose and oversensitive to smell. Frequent bleeding of nose with watery discharge in chronic form. Congestive headache with courage. Frequent bleeding from the nose. Nose swells up and becomes purple. Strawberry nose. Red knot on the end of the nose. Lachesis is important and useful in drunkards who have red nose with heart affections. You can think of lachesis. What are the throat or tonsillitis symptoms? Pain begins on the left side and goes to the right side. Throat and neck sensitive to external pressure and touch. Everything about the throat distress, even the weight of the bed covers. Person is having so much of always wants to wear the loose clothing. Sensation as if they impaired circulation with a kind of suffocative feeling. Empty swallowing or swallowing of saliva or liquids aggravate much more than solids. Pains in the throat runs up to the ears. Much mucus in the throat, and it's also painful while coughing. Dark purple appearance of the throat. Sensation of fullness in the neck with difficult breathing. Choking when going to the sleep. Sensation of lump in the throat which descends on swallowing, but some returns. Patient is really kind of always coughing. Extreme dryness in the throat without thrust, and always feels not okay after sleep or warm drinks or touch. And you can also give an diphtheria, swelling of the throat, internal and external with unbearable odor, and rapid pulse with an high temperature, muttering delirium, purplish appearance of the lips. And lachesis is very useful in this kind of treatment. And you can also give it in the treatment of asthma. Sudden flashes of heat or the blood to the chest. Must loosen clothing to prevent suffocation. Paralysis of the heart and lungs. Dry hacking cough aggravated by touching the throat or larynx. Cough during the sleep. Cough. Dry hacking cough aggravates after sleep and is associated with a sensation as if the fluid has gone into the wrong passage. Cough is mostly dry and is raised with great difficulty. It is systematic with cardiac affection. What are the gastrointestinal symptoms? Mouth. Gums are soft, swollen and spongy with easy bleeding. Gums turn purple. What are the tongue symptoms? Tongue always trembles and with great difficulty, dry tongue, and they have always bluish black appearance of the tongue. What are the stomach symptoms? Pit of the stomach is sore to touch, or even the pressure of blood clots are really kind of aggravating for them. Cannot bear any pressure about on the body, even the touch makes them really go into one of the bad state. Warm drinks and hurtful are hurtful to the stomach. Nausea and vomiting can also be started. Increased palpitation, fullness of the head. Cold drinks causes nausea with a tendency to vomit. Abdomen, painful distension in the abdomen, which is very annoying and can bear no pressure. The patient is obliged to loosen clothing and pull up the nitrous to avoid pressure. Surface nerves are very sensitive, cannot lie on the arm across the abdomen because the touch aggravates. What are the liver symptoms? Jaundice, congestion, inflammation with nausea and vomiting of bile. White stool, cannot endure any pressure about hypochondria, worst after sleep and heat. What are the stool symptoms? Means motion. Lachesis as peculiars in this, there is urging or rather a pressuring down in the rectum, which is worst when he attempts at the motion. Painful constriction which prevents the motion or is also followed after an incomplete or unsatisfactory one. The stools are always very offensive. Hemorrhage from the bowels and decomposed blood during the course of exhausting disease like typhoid. Everything. Always the piles or hemorrhage. Blunt or bleeding piles with a constrictive feeling sensation as if little hammers is been beating in the rectum. Even during the headache symptoms, you can also find this a common sensation. How is the female of lachesis? Menses at regular time. Duration is very short, means 2 days or 3 days. Quantity is scanty. Character of blood is dark, watery, and non-coagulable. What are the modalities? All troubles are revealed by menstrual flow, menstrual suffering before and after the flow. Concomitant symptom in the headache, I had already said. What are the concomitant symptoms? Headache during menses, nausea and vomiting during menses. You can think of. During menopause also you can give great remedy during menopause. The patient always says that from that time onwards I am not well. And with the hot flashes and headache, migraine, headache with pouring pain in the vertex, pale face with faintings, uterus does not bear contact, has to be revealed from the pressure, frequent lifts clothes, and they also want to wear the loose clothing because of the uh, sweating or the warmth which they are feeling, and they also feel this tenderness also. Ovaries affects the left ovary mostly, like tumors, cyst, and CA of the ovary, and induration. Troubles begin in the left and go to the right. Uterine displacement, womb prolapse with congested and persistently obstinate hemorrhages, and a pale face with fainting. Uterus is very extremely sensitive to touch or of even wet clothes. Okay, moving on to the skin symptoms of the lachesis. Lachesis is useful in ulcers, carbuncles, abscess, and black measles, smallpox, boils, wet sore, everything. Fungus affection. Affected parts are very sensitive to touch and look bluish. Discharges are very offensive with intense burning. They must rise at night and bath in water to relieve the burning. And suppuration is also seen. Blood decomposes or breaks down and becomes non-coagulable. Bleeding easily starts and very persistent. Ulcers and wounds bleed profusely with a tendency to become gangrenous. Moving on to the nervous system, because you know that how the snake walk, because they are very nervous system. If you go to trembling from extreme weakness, person feels faint as if she must really sit down. Great weakness is there, both mentally and physically, on going to the sleep. Weak heart, nausea, pale face, and vertigo is also seen. Left-sided paralysis with cerebral exhaustion, weariness, and so much of weakness. The patient says that I cannot do anything on my own. This is one of the peculiarities of the Lachesis. If you are going to compare the Lachesis with any other remedies, you can just kind of compare it with apasulf, like sodium nitric acid. But you can also really kind of give Lachesis in an intermittent fever, and this remedy is very useful for me. According to me, in my clinic I had used it to treat the patient who comes with nervousness, fear, or this suspiciousness is been troubling them, because even if they think that they should not be so much suspicious even with a little bit of thing, but they are doing it. So when they come to take the treatment that time I had given, and the patient who comes with the headache also, because the headache with the Lachesis is very irritable, because they always have this kind of sensation, and they also says that I cannot bear this headache, because after my period stops the headache starts. So what I'm going to do, because they feel it so unreal or unusual, so they want to take the treatment and they come. During that time also you can give it. And respiratory symptom I had already said. In diphtheria you can give, in tonsillitis you can give, and in asthma symptoms you can give, and in the cough also you can give. But the only thing that the means, if you are taking a case taking just for an cough which was started 2 days before, so that time what you should do is, okay, take the physical symptoms. After taking the physical symptoms like dry cough, which is more after the sleep and associated with a sensation of pressure, cough is very dry, and even with so much of difficulty the patient cannot spit out. This is the symptom which the patient sees. After that, you should go with the aggravation and amelioration factors, like when the cough is more, they say that after sleep, so that is the aggravation factor. When you feel better, so when you take the betterment, they say that okay, when I spit at least little bit of saliva outside, that time, okay, or if I sweat, or if there is nasal discharge, I feel better, like that. Okay, then you can think of, okay, this drug is been matched out. So you should also go to the mind symptoms. Then you should ask what you are feeling, means what your mind is feeling now. They say that even I'm coughing so much but I cannot stop my talk. There is great loquacity, means the patient continuously keeps on talking. And they also say the cough symptoms, and they jumps to the sleep. After going to the sleep, they come to the cough or the mind symptoms, or they go to the stools. That time also you can think of, means there is constantly changing of ideas or talking, means from one subject to another subject. They always constantly change from here to there, from there to here, like that. That is one of the peculiar symptoms you can think of. And you can also ask about headache symptoms during the cough. Do you have any kind of headache, like that? If they say that there is headache, look for the ambring or type of pressure or pressure headache, which is also aggravated after sleep, that kind of thing. And side affinity should also be confirmed during the Lachesis. Of course, in some patient there will be no side affinity, but in some patient there will be side affinity, so you should look into that also. That is from left to right, or it also stays in the left side. And you should also look at the complexion, but if the complexion is not been matching, it's also okay. At least the 4 symptoms, like one mental symptom, two physical symptoms, one general modalities is been matching, then you can go with the Lachesis. Okay, now discussing about what potency means. What is the potency which you should be giving for the patient. If you are going with the acute treatment like cough, go with Lachesis 30 morning and night BD. But if you are going with the chronic treatment, go with the Lachesis 200. What are the chronic treatments like migraine? It's almost been 2 years to 3 years, or any asthma kind of thing, or any stool problems, piles kind of thing like that, or bronchitis, you can go with Lachesis 200. And Lachesis 200 when early morning, as soon as the patient wakes up, before they brush, you give 4 pills. After that, they ask them to wait for 10 minutes. After that, they can drink water and they can just go brush, do whatever they want. After 15 days, the same dose is been repeated. Means 15 days, only one dose, 4 pills, 200 potency you will be giving. If you are moving on to the mind symptoms, means the patient, of course they have physical symptoms like asthma, but the mind symptoms are very troubling for them, like suspiciousness, anxiousness, nervousness, fear. All this kinds of thing is been really bothering them, and they cannot concentrate, and because of that, means once they will be sitting on chair, they gets up, they sits on sofa, they gets up from there, they goes to the bedroom, they also go to the kitchen. They cannot fix their mind in one position. That time, when the mind symptoms is being involved, you can just think of 1 potency. Okay, 1 potency when to give? 1 month once, that's all. Tomorrow early morning, if you are giving, after the next follow-up, after taking the follow-up symptoms of the patient only, you should be given. If in the follow-up thing the patient is saying that, okay, now I am feeling better doctor, my mind symptom has been reducing and even the physical symptoms have been coming down, I am perfectly getting better, and the improvement is almost 20% or 30%, then you should not repeat the medicine. Just wait with the Saclac or the PL placebo treatment. If the case go to the standstill, and next follow-up the patient comes, okay, last time when you gave the medicine the symptoms was coming down, but this time after even waiting for 1 month, I'm still on that stage only, or only 10% has been reduced. That time you can repeat the dose, because the repetition is needed. For some people the repetition is not needed, only the correct medicine with the correct potency, if you give only 1 dose, can work as miracles. But for some it asks for the repetition. So as a practitioner, as a doctor, you should be knowing when to repeat or how to repeat, or which potency should be given. The patient also complains of only the general modalities, means they are not okay by sleeping. After sleep, all the complaints are really kind of going bad, like climatic changes, like rainy season. It was sunny in the morning and afternoon it was raining, and they started with the headache or the cough or the fever kind of symptoms. That time also you can give in the acute 6 ch or 30 ch. There is no need to repetition. Just ask 2 doses to be taken in a 1 day. After that, just wait for 2 days. If the symptoms are really getting down, there is no need of repetition. I had given Lachesis for the people who are suffering with the asthma, with menstrual troubles, and with the people who come with PCOD, or with the females who come with scanty menses, because the menses is very, means the periods is very short duration, 1 or 2 days, and it's also very scanty. That time also I had given it, and I had seen so much of miracle thing which is going on with the Lachesis, because I had given the medicine for this kind of part, but it has also changed the person mentally and other symptoms also, like he was unable to take the uh, hot milk or any kind of warm drinks, but now at least the minimal warmth they can take, and the constrictions is been reduced, and everything is been going well that time. And the pulsation all over the body, of course the pulsation all over the body cannot be heard every time. It can be only heard during the fever, or when the patient is tensed or is um, having any kind of means nervousness, anxiousness, or uh, during the fever or any kind of changes, only you can view that, but not in all the situations. And I had also given the Lachesis in one of my patient who was having left ovarial cyst, which was almost 8 centimeter, but it got reduced, but it took me almost 6 to 7 months to reduce that cyst, but it was a nice case. I gave that because it was a left ovarial cyst, and she also had scanty menses. And she was very talkative, she was very open to the means she was bold, she was ready to talk with anyone, and she was means her face was so attractive, means she was very beautiful to look at. And this was the symptoms which I really kind of considered. Of course the aggravation of the sleep, that all did not match, but according to this I just gave her and I started with Lachesis 200 every week once. After that, after 2 months, I think I did a scanning. There, the reduction was done for 2 centimeters. Then I increased my potency to 1 m. Then also it was carried on for the 2 months. Again, it was only reduction by 2 centimeters. After that, I started with 50 millismol scale, which I gave it 1 spoon in the morning, 1 spoon in the night. This gave me the complete overall conclusion for this case, because the 4 centimeter which was released in next 2 months. So the patient was so happy, and she was really kind of saying that homeopathy is really a miracle. Without any side effects, without any surgery, I was able to cure, because they asked her to remove that, because it was troubling her also with other kind of thing. So she just wanted the treatment which was safe for her, and she came to know that homeopathy does not have any side effects and can be treated with only with the medicines, with the help of medicines. So she just came with a doubt, but her doubt was cleared, and she has also referred me 2 to 3 patients, but not the similar complaints but other complaints, but reference she gave because the treatment was done very completely. So knowing the disease is also one of the challenging thing for the doctor. First know the disease, then diagnose the disease, then rule out the symptoms from the patient, ask the question and takes the symptom, then repertoire, then you find out one indicated remedy which is almost similar to the patient. Then the potency also plays very good and important role in the treatment. So if that is given correctly, you will be on the top notch. Because if I did not move to the LM potency, I could have taken 1 year for the treatment for her, but because I moved very fast to the LM potency, because I saw so much of improvement, the case was solved in the 6 months. If you have any kind of doubts about anything related to homeopathy, you can just comment on the comment section. I hope that this video was helpful, and myself, Dr. Megha from Homeopathic Clinic, who is an clinical practitioner, physician who is practicing the homeopathy from 5 years. If you have any kind of suggestion for me from your side, or to my channel, or to do any videos accordingly, you can just comment on the comment section. If I had missed out any kind of thing in this video, please do forgive me, and I'm really thankful because I really uh, happy that I'm helpful for others. Thank you so much for always supporting me and my channel like this. I really need your support to my lifetime. Thank you so much, and have a good life and a fantastic life. Everyone wants to live their life like an bright and happy, because the happiness is the one thing, is a key for us to live happily. So let's be happy, have a fantastic life and a good life. Have a nice day. Bye bye.